Imagine you're a frontline clinician facing challenges every single day. Now, what if I told you there is one skill that can help you anticipate challenges, seize opportunities, and future proof your career planning? Would you be interested to know what that skill is? I'm sure you would be. It's called strategic thinking. Hi, this is your Priya Physio. If you haven't already subscribed to my channel, please subscribe to my channel below so you get live updates of when my videos are posted next. So let's dive in. What is strategic thinking? Okay, and why is it important for healthcare leaders or clinicians to have this one skill? Okay, why more focus? Because as clinicians, when we are training in our university, strategic thinking isn't a skill that has been taught to us directly. But when you come out in the real world for job, applying for jobs and working with a multidisciplinary team or even leading teams as a senior clinician, you need to have strategic thinking as a skill because problems just arise. You need to know how to solve them, how to tackle them. Opportunities, we get presented with opportunities every single day. Do we know how to recognize those opportunities? Do we know what to do with these opportunities? Not sure. And you could just turn up and say, it's not possible because this hasn't been taught to us. If that is the answer, this video is for you. Okay, so let's dive into strategic thinking. Strategic thinking is a skill which helps you with three things. Number one, anticipate challenges or identify challenges before they arise. Number two, helps you identify opportunities. And number three, helps you with long term success of your department and organization. So let's dive into what are the key aspects of strategic thinking. Five key aspects: goal setting, anticipating trends, resource allocation, problem anticipation, and continuous improvement. Now, before we start with goal setting, let me just go with an example. Now, imagine that a ship is leaving the harbor from UK to go to the United States. Just tell me, if the captain doesn't have SMART goals for that ship, do you think the ship will go anywhere? It will just leave the harbor and end up in a ditch because it doesn't have a map, it doesn't have enough resources, it doesn't know how far, how long it is going to be traveling in the sea. The ship or the captain doesn't know what to expect, and they don't even know if it is going to be realistic and achieved in real time frames. Okay, that's why goal setting is very important whenever you're trying to build your strategic thinking skills. See, strategic thinking is a mindset shift, it's a mind skill. You have to be able to be a strategic thinker if you want to be a leader or to solve problems of your department and organization. So this is SMART goals. SMART is specific, measurable using relevant outcome measures, achievable, relevant or realistic, relevant to your department, and timed. Give it a time frame and see if that goal setting is going to serve you or not. Okay, so that is step number one. Step number two, anticipating trends. Now, why anticipate trends? Okay, you anticipate trends because you need to know what's going on parallelly in around you. So if you are a rehab manager or if you're a team leader of a rehabilitation team, you need to know what other things are other rehab managers, other rehab services doing which is different from yours. How can you do that? By analyzing data, your own data to start with, to see where you are, and analyzing data of a similar service around you in your hospital, in your region, in your country, and compare and see what is different and see if there is anything that you can bring back from that data, from that particular service. Attending conferences. So, conferences, events, workshops, engaging with other people, understanding their lessons learned, and sharing best practice. So, if you have something to share, share, but make sure you get whatever they've tried and tested and it has worked or it hasn't worked. Number three is engaging with thought leaders. So always ensure not just looking at yourself or your rehabilitation professionals, but look at other thought leaders in the same field or in a different field where you could bring those learnings back to your department. And how do you engage with thought leaders? Various platforms. It can happen at conferences, events. It can happen in, you can go on social media like LinkedIn. LinkedIn is really good. You have various platforms like TED Talks, podcasts, YouTube, social media nowadays, CSP and HCPC, NHS Careers. Everybody is on Facebook and Instagram as well. So there are ways of how you can engage with thought leaders. You should just know who are the thought leaders who can help you in that particular problem. Okay, and then bring those trends to your department and see if it works. Number three is resource allocation. Remember, resources are finite. Even if you deny, resources are finite. Finite as in they are going to end one day. Okay, be it people, your staff, finances, or anything else. Okay, so what can you do? You can focus on high demand services, ensuring that you are allocating resources appropriately. Focus on high demand services, see what's working there and why is it requiring more energy and more resource. Is it taking a lot of resource, which means that there is nothing left for other services. Number two, optimize staffing levels depending on the demand of the service. And number three is prioritizing technology upgrades. Very important. Ensure you are using appropriate AI channels, AI models for your particular service. Example, how can you help analyze the data? Okay, there are various other organizations, NHS organizations, and good organizations who are working on artificial intelligence to ensure that it is used safely within healthcare. So make sure if you are a healthcare leader, make sure you're aware of those technology advances and don't leave yourself behind. Try and embrace AI. It is a boon. There are always pros and cons of everything that we have around us. You have to be clever enough to understand what works for you and what doesn't. Number two is problem anticipation. Okay. Now, everyone has problems. Every department is going to have problems. You, as a clinician working as a frontline clinician, you will have your own problems. Your team leader will have problems at their level. Your general manager, your operational manager will have problems at their own levels. So, two things to understand whenever we talk about problems: potential obstacles, what is stopping us, and solutions. Okay, so what is the real problem and how do we solve it? Potential obstacles: policy changes, okay, funding cuts, supply chain disruptions. Very major, just over the top. If you scan healthcare anywhere in the world, you would understand policy changes, funding cuts, and supply chain disruption. Supply chain disruption is, for example, if you are dependent on equipment from another country, okay, if it is being sourced from another country to your country, or if it's being the production line is in another country, but you have to use it and the company is based here, then supply chain can be disrupted if there are problems in the other part of the world, which means that production line is stopped and you won't get that equipment. This sounds too technical, but trust me, once you start applying these steps in your role, you will understand that these are not that major. All you need more practice on what we are talking. The terminologies, the more you use it in your day-to-day life, the more you can say you're a strategic thinker. Okay. So potential obstacles could be policy changes, funding cuts. Okay, funding cuts, a very good example is the NHS England's news, and it is going to be merged with Department of Health and Social Care roles. So the roles are going to be streamlined to avoid duplication. Remember, everyone is different. What you see as a problem, someone could see that as an opportunity. This is a big strategic change by the new government, which means that there is something for clinicians. Remember, everything that everyone is doing around the healthcare is for patients. Everyone is trying to act in the best interest of patients. That's exactly what is happening with this recent news. Everyone is thinking about patients, and patients are always at the heart of everything we do. No one is right, no one is wrong. They're trying their best. Okay. So, with those funding cuts, what is possible? What are the solutions you can apply? Is what you need to think about. You know the problem, acknowledge it, write it down, try to find a solution rather than discuss problems with everyone. And supply chain disruptions, we have spoken about them. I've given you an example. Now, solutions wise, what does What is solution? So what do you need to do if you know a problem? Okay, let's take an example of funding cuts. You need to have contingency plans. Is a service, if a service was going to be shut completely, okay, because of whatever reasons, you need to have contingency plans of who else can pick that service, or can it be absorbed by another existing team, is what you need to think about. Okay, risk assessment tools. There are various risk assessment tools. You can use any that work for your own problem, your own department, your own sector, and use those skills. Okay, in project management, there is something called as risk profiling. Okay, to assess risks, whether it's a moderate risk, or it's a high risk, or it's a low risk. That way, you have risk assessment tools for everything. Scenario planning again goes on hand in hand with your uh, with the discussion that we just had a few minutes ago on AI. Okay, model hospital or hospital planning, bed planning. Okay, so there are tools which will help you with scenario planning. So do not worry about that. But if you get a chance to look at one of the scenario planning tools, please, please, please step up and go and ask. If you don't ask, you don't get. Okay, go and see how it works. And that way you'll have examples when you are going to an interview and you want to answer a question on scenario planning, on bed management, or hospital discharges. You will have an idea of what a tool can do. And once they know that you know that tool, you will be on the positive side. Okay. And SWOT analysis. What is SWOT? SWOT is your strengths and weakness analysis. Right. So this was problem anticipation. Finally, in healthcare, it's all about continuous improvement. It's all about sustainability. It's not about identifying the problems. It You cannot just leave at finding solutions and leaving there, because there's a highly likely chance that it is going to revert back. Okay, the teams will quickly revert back to the previous ways of working, especially if you're implementing a new service, a new way of working. They would easily fall back to the old ways of working because that's what they are used to doing. Okay, so continuous improvement plays an important role. How do you ensure continuous improvement? Okay, it's very important to encourage innovation. Okay, encourage innovation. Now bring that with this one. Okay, empower your teams for innovative ideas. If your teams feel confident enough to speak up in a team meeting to you separately, that means you are going to have more and more innovative ideas, and that's how you truly encourage innovation, because you're being open with your teams that their and you're showing them that their views and views are heard. Okay. Now, number two is feedback loops. Make sure as a leader you have some feedback loops. The complaint boxes we have, or the feedback boxes we have in some departments. Some departments do it regularly, some don't. But that itself is really good, because if you're implementing a new change, introduce a feedback loop or just a box somewhere in your department so people can feedback without being seen or heard of what they are feeding back on. If that is something, if confidentiality is a problem, they can give you feedback, and you as a leader, you as a team lead clinician, can go and review what the feedback is on the innovative step that you're taking. Okay, so it is like you give that information, it comes back to you in the form of feedback, and you integrate that feedback into your system, and the innovation takes place, and it's a better place. And then you're in a better place to go ahead with that innovative idea, if that makes sense to you. Periodic performance evaluation. So, what are periodic performance evaluations? Okay, so whatever uh, problem solving you've done strategically, with the feedback loops, you need to evaluate what has changed. Okay, once you evaluate what has changed, has the performance of the team changed? Have the waiting times reduced? Okay, the wait time reduced. Are patients happy? Are staff happy? So you need to have those evaluation. That's why your smart SMART was very important. So if you look at my video again from start to end, you will realize that all these 5 steps are interlinked. Okay, goal setting, anticipating trends. So goal setting, SMART, actually it guides you step by step in order for you to be a strategic thinker. Okay, and if we go to the final one, which is continuous improvement, you will understand for encouraging innovation, okay, you've got to encourage your teams. Have feedback loops. Once you have that feedback, you implement that, evaluate the performance of your team, evaluate the performance of that service, and you will understand whether that particular team, that particular service is working or not. With these evaluations, you will understand that it is working or it isn't working. If it isn't working, that means you have to look at something and try to solve that problem. Hence, it's like a circle of things that you have to apply. And this is thinking. Okay, the more in depth you know a service, it is going to be easier for you to be a strategic thinker. I hope you understood the key aspects of strategic thinking and why, as a clinician, it's important for you to embrace strategic thinking as a skill. Even if it's not taught to us during our university exams or during our college time, you know now that if you want to survive in a ever changing healthcare landscape, you've got to be a strategic thinker, whether it's a requirement of your role or not. It will help you both in life and workplace. Okay, before I go, if you haven't already joined Physio Leaders Club on Facebook, please do so now. I host weekly webinars on physio leadership, which are free to attend. If you haven't already attended, please do so now. The link is in the description. So click on that and you can register for my webinar. The link changes every time. So if you have attended previously or registered previously, you still need to do it because you'll get a new Zoom link. And that is how you can take your first step towards your own career journey. This is your Priya Physio signing off. I hope this helped you. Bye.